Okay, good morning, everybody. This is Elaine Chen at the Center of Excellence on Elder Abuse and Neglect at UC Irvine. We're so happy that you could join us for this webinar on innovative long-term care ombudsman practices. We are delighted to be joined by Karen Jones and Molly Davies, our presenters today, who both have head up long-term care ombudsman programs and are very active in elder abuse and neglect prevention. I'm going to introduce my colleague, Alicia Chan, who will help orient everybody with this webinar room and some of the technological aspects here of our Adobe Connect webinar.
Hello, everyone. I'm logged in as Mary Toomey right now, so if you see anyone replying to your questions as Mary, then that will be me.
And people are welcome to join, to listen in using their headsets or computer speakers, or by calling in on the number shown on the screen, 866-579-8173. And you can follow the prompts to receive a call in or dial the number directly.
Please direct any technical questions to the chat pod on the right-hand side.
So the format of our presentation today will involve a presentation by Karen Jones. And she'll be talking about disaster preparation. And then that will be followed by a presentation by Molly Davies, who will discuss unlicensed care facilities. And we would love for you to be able to interact and take advantage of our presenters' knowledge as well as that of the other participants. So to do that, please do feel free to type in your questions in the chat pod. And we'll have a question and answer session in the last 10 or 15 minutes of our 1-hour webinar today. I want to just briefly introduce our speakers. Karen Jones is the Executive Director and Program Manager of the Long-Term Care Ombudsman Program in San Luis Obispo. She has been working with the County Office of Emergency Services, the Public Health Department, and long-term care facilities in her county to create and distribute a standardized disaster plan. She's also very active leading the Adult Abuse Prevention Council in her county. Molly Davies has been a long-term care ombudsman for over 12 years, and you can see she's been pretty busy. She's developed trainings for the prevention of inappropriate discharges and transfers from hospitals, working together with hospital discharge planners. She oversees the long-term care ombudsman program in Los Angeles City and LA County. And she's the Vice President of Elder Abuse Prevention for Wise and Healthy Aging. And they've piloted many innovations, including psychotherapy for elder abuse survivors living in the community and in facilities. She's a leader in the California Long-Term Care Ombudsman Association and California Elder Justice Coalition. And we'll give you a little bit more information about that later. Now that you know a little bit about our presenters today, we want to find out a little bit about you. So if you see on the screen, there's a little poll, and please go ahead and click the category that best fits your role. Thank you. It looks like more than half of the people participating today are long-term care ombudsmen, and there are a lot of people in the other category. I'd be interested to see if you wouldn't mind typing in the chat pod, um, a little bit about how you describe yourself in your role here. The multiple attendees are typing. Oh, probate examiner, probate investigator for the court, long-term care ombudsman, program and policy manager, paralegal, all kinds of backgrounds here, Alzheimer's daycare. Thank you very much for letting us know a little bit about you. Legal aid, IHSS. Great. Thank you. And I just wanted to thank the Archstone Foundation, which made this webinar possible. They have given us a grant to the Center of Excellence in order to provide these webinars for California elder abuse prevention professionals and people in aging services. And towards the end of the webinar, you'll see a survey in which we would love to get your ideas about topics for future webinars. Just very quickly, I wanted to talk about the learning objectives today. You can see they deal with emergency planning and response, learning the importance of preparing both your home and your program for emergencies, reviewing communication options for use during an emergency, and then after Karen's presentation, Molly Davies will talk about key indicators of unlicensed facilities, risks to residents related to placement in unlicensed facilities, and a collaborative approach for responding to unlicensed facilities. And again, please do feel free to type your questions in the pod throughout the presentation, and we will have a Q&A session at the end of this webinar. Now, without further ado, I will pass the baton to our presenter, Karen Jones. Thank you so much, Karen, for joining us.
Thank you. I'm going to recommend to anyone still listening by computer that they switch to the phone because it's not cutting out so bad. Otherwise, it's like trying to learn a language when you only hear a couple of words. So welcome, everyone. I'm going to start by talking a little bit about, I guess we have a poll. So we'll let you fill that in. Okay, so it looks like most everybody is not particularly involved in disaster preparedness. All right, but still good to know. And there's always, this is why we're here, hopefully, so maybe we can learn some tips for doing a little bit more. So the next slide here is kind of reasons that ombudsmen typically would have for not doing disaster work. And I've heard over the years from ombudsmen that we're not disaster workers, and I would agree with that statement. But I do believe we have a role, and here's some reasons people say we don't do disaster work. Of course, funding is always an issue in any organization. Training is a big piece of it. And also that we don't have the resources to do what we're supposed to do now, particularly for ombudsmen who've, well, everybody's faced budget cuts. But ombudsmen were cut pretty severely in California in 2008. So we don't have the resources to do all of our work we're supposed to be doing. How do we add disaster work? And then, of course, there's an awful lot of agencies with the government, that, county, city, federal, and state that are supposed to be doing disaster work. And, of course, there's a lot more knowledge about this than an ombudsman would or any other agency. So those are some reasons people might have for not doing disaster work as an ombudsman. And then, of course, there's my favorite, which is the reasons why, yes, we should do ombudsman disaster work. And that would be that we're funded to do advocacy, and of course, disaster work is advocacy. And that there's an awful lot of training that's available, and a significant amount of it doesn't have any cost, other than perhaps transportation and food and hotel stays if they're out of the area. And that if we don't have the resources for preparation, how are we going to deal with the disasters? And of course, they're going to happen at some point. And finally, of course, that government staff and agencies who deal with disasters rarely know anything about care facilities. And in fact, pre-Katrina, there was almost a decided effort not to include care facilities in disaster planning, with the false hope that because it's a licensing requirement, those facilities will do their own disaster preparedness. And we all know, after seeing Katrina and some other issues, the facilities need help, just like a lot of other folks when it comes to disasters. So let's talk a little bit about those ideas that other agencies have. One of them is in my area of California, they have, we do a lot of disaster drills, and that's partly why we're involved. We also have a nuclear power plant, which makes a big difference, and it's the only active one going right now in California. But in 2006, we were doing a drill, and we were sort of pretend evacuating a large nursing home. And the folks in the disaster preparedness were very happy. I mean, they were, they'd solved the problem. How are we going to evacuate a 150-bed facility? Where are you going to put those folks? And they decided that they'd found a nursing home in Escondido, which is, on a good day, 6 to 8 hours away from our area. And we weren't as happy as they were in any way. In fact, I would say we were gravely unhappy with the decision for a lot of reasons. But the biggest one was people from care facilities getting on a bus and being on it for 6 to 8 hours. Someone's going to die. They don't travel that well that way, and that's not a good way to move them. But there was, hundreds of nursing homes along the way where they could have stopped that were only, 30 minutes to 2 hours away, and would have been a much better choice. So that's the kind of thinking that happens. They find a solution wherever it is, and they don't really have a concept of these other issues that you wouldn't maybe have with if you were evacuating a daycare full of children. Oops, I pushed the right spot. So I've peppered the presentation with some photos of disasters, and a lot of it's just to keep us thinking that, what happens when that fire shows up? It's not a good time to start trying to make a plan. And in California, we know fires happen. So one of the things an ombudsman program can do is just get involved. And part of it's finding out where to get involved with, who to talk to. That was my biggest challenge when we were looking to do this about 5 years ago. But we finally eventually figured out that, the county has an Office of Emergency Services. It also has a Department of Public Health. And both of those agencies are charged with disaster preparedness for special needs populations. And that's what care facilities are considered to be a part of. Once we found them and started talking with them, initially they said no, they didn't need our help. And that was pre-Katrina. After Katrina, they said they really wanted our help, and we were invited to participate. And so when they first said no, we really tried to get involved, and we continue to remind them that they have an obligation to ensure that long-term care facilities are represented. And more right now, this is making big news. So if you hear the stuff coming out of Sandy, they're really looking at making sure the disabled populations and special care facility folks are being represented in everyone's disaster planning. So this is a great time to get involved if you have an opportunity to do this. Each county has a bunch of standard operating procedures. These are called SOPs, and they're for all types of disasters. You can, if nothing else, you can ask for a copy of those and see what the plans are for care facilities that are already in place. Disaster planners, one of the issues we have with ombudsman or social service agency folks wanting to do disaster planning is learning the language. Disaster planners don't really talk like most of us do. Every industry has its acronyms, and ombudsmen are not short on those ourselves. But with the disaster planners, it's even more significant. They just talk in significant amount of code, and it's important to learn what that means. I've also lately started calling out the planners in our area and saying you need to quit using all your acronyms and say the word. especially if it's only a 2 or 3 letter acronym. It's not that we can't say the whole thing. Like, for instance, an SNS, that's what they often say. They need to talk to somebody about the SNS, which stands for Strategic National Stockpile. It certainly doesn't take a lot longer to spell that out or to say that out than it does to say the acronym. So we've been really pushing to get the language verbal instead of acronymed. But you have to learn that in order to participate in disaster planning. There's places to go for disaster planning preparation, and one of them is the Incident Command System training. They call it ICS, again, another acronym. And it takes about 15 minutes to get this training. You can Google ICS NIMS. NIMS stands for National Incident Management System. And that's where you can kind of get a start on learning the language and how the system works when there's a disaster in your area. And then, of course, the National Ombudsman Resource Center has a lot of good resources for ombudsmen with what we can do when facilities close or when a disaster happens. Okay, and here's an earthquake. Again, those can happen also, and once that earth starts shaking, is not the time to start wondering what your ombudsman and staff are going to do in a disaster. So we want to talk about preparing your program. And the first thing is you cannot help care facility residents if you are not prepared yourself. You have to be prepared at home. All of your ombudsman staff or your program staff, if you're not ombudsman, need to have their own workable disaster plan and supplies. This is particularly important if you have young children at home. You can't go in and be an ombudsman and work on disasters with care facilities during a disaster if your own children will be at home alone without any assistance. That's not workable. So you have to make plans. Same with your pets. A lot of us have pets that we want to make sure are safe. If you're off racing to take care of your pets, you can't be making sure care facilities are doing well. And then, of course, the Ombudsman program itself has to have a plan. So the basics to start doing disaster preparedness are what we all need to do, which is prepare at home and prepare at work. And some of the things to consider is how you're going to communicate if phone lines or the internet are down. So much of what we do is based on having electricity to run our phones in our offices and our internet. So what are you going to do if those things aren't available? And also, what services can you provide during a disaster? You probably can't do everything, but maybe there's some basics that you can still do. And then, of course, how are you going to know which facilities are actually in operation, where those evacuated residents have gone? I think, to me, one of the saddest parts about Katrina and the aftermath of it was months and months, I think 6, 7 months after Katrina hit, I was still getting emails from people looking for their loved ones who'd been in nursing homes in that area. They had no idea where they had gone. And a lot of the women or the residents who had Alzheimer's or memory loss couldn't remember or couldn't speak their name, so they couldn't even help rescuers try to figure out who they were and who they belonged to. Another great picture, this one's a nice flood. Those also hit. We have areas in my county that are very low-lying, and there's a nursing home in the middle of that. Not sure why somebody built a nursing home next to a large creek that can rise and be near the ocean and have floods, but we all have that, and again, preparation. So what I want you to do is talk or think about being realistic, but also being cautious. It's really important when you start working with disaster planning that you be realistic about what your office, your organization can do in the event of an emergency. You simply cannot commit to doing things that are outside your scope or that are outside your resources. If you don't have the manpower to do something, it's important not to take that on or commit to doing it. The other issue is you can't commit to doing services that are outside your scope. So an ombudsman, cannot be sorting through rubble, cannot provide first aid to victims or transport people. It's outside of our scope. As I tell my ombudsman, we don't have insurance for that. So we don't have a lot of protections if we're doing things that we don't have training for or abilities to do. And this is one of those infamous photos from the tsunami. I happen to be on a coastal area, so tsunamis are a problem here. We've had one tsunami warning. I think the ocean rose about an inch. It didn't get very far, so it wasn't a big issue, but it could be, and it's always a risk here. One of the other things you need to do is practice. If you're not practicing your home and program disaster plan, you're not going to be really prepared no matter how well it's written down because you haven't worked out the bugs, and there are bugs in every disaster plan. You also want to participate in any local, county, state, federal disaster drills that you can participate in. And again, if you call your emergency planners for your area, they'll have drills. It's a requirement. They have to have all kinds of drills. This year it was water shortage, having the water mains broken or water systems down. Some years the big push with county and state and federal folks is on terrorism issues. So there's always kind of an annual theme, and there's always some type of plans going on to hold drills of various kinds. Some are tabletop, some are in person, where people go actually flood the hospitals. So there's all kinds of them to participate in. There's also the annual Great Shakeout, and this is a nationwide earthquake drill. It happens in October, and you can actually Google Great Shakeout, and you can get some information on how to participate. It's a good thing to do in your local program, even if you don't plan to participate beyond that as far as disaster preparedness goes for facilities or with the county. But it's a great way to see what your own program is and what your ombudsman or your volunteers and staff have going for them as far as their own planning. And then, turn temporary emergencies into opportunities. In our area, for some reason, we lose power every once in a while. We're semi-rural, not rural that much, but whatever. The power kind of leaves us every once in a while. And it's interesting how often we forget things. Our phone system is based on electricity and phone lines, so we have to have the electricity part. And with that, when we lose our power, we lose our ability to reuse the phone. So, turning on our backup system for phone communication and transferring our lines. Those are all really important to making sure that we're, that we have ability when a real disaster happens and those outages last much longer than a couple of hours. The same with internet. We are so dependent on the internet now. Ombudsmen around the nation are dependent on the internet for our database that we use for facilities. We really need that. So how are we going to get to it if we can't get it restored right away? And what are we going to do instead? So those are opportunities to plan for, to prepare your plans and to revise them, because you always find something more that you could do, and keeping things written down is really important. And then we have tips. I'm almost done here and turn it over to Molly, but communication is really key. If you're in the middle of a disaster, you need to be able to communicate. Cell phones, landlines that aren't electricity-based, kind of those old-style phones that just plug right into the wall and aren't dependent on electricity. In our area, we have satellite phones in all the nursing homes and for the Ombudsman program. Those are helpful if there's no other form of communication. They're also very expensive. There's also shortwave radio. There's texting, which actually is slightly better than cell phones as far as use, and you can often text when you can't get a phone line. And then there's emergency radio stations where you can call in and use them as a hub, if, of course, you can call in, and websites if you can get to the internet. So that it's always important to have a backup plan for communication and have multiple redundant systems where maybe you have a landline that doesn't require electricity, you have your cell phones, and you also have access to shortwave radio. And the other thing is to have a backup plan for sending out your ombudsman in case you can't call them and you can't reach them, so they need to know what they're going to be doing in a disaster if you can't actually give instruction. We also have a couple of really great services, and one of them is the GETS card, the Government Emergency Telephone Service. You can go on their website, and it's right here on the slide, and sign up, and it gives priority for using a landline phone. So, for instance, if there was a disaster in my area and the phone lines were either down or overwhelmed, more likely overwhelmed, if there's any way of getting any signal or dial tone at all, I'm going to get priority over somebody else who doesn't have a GETS card. It gives me access to getting a phone line before somebody else might get it. And it's only for doing emergency work. You can't just use it to call and check on your puppies or anything. The other thing is the wireless priority service. It's also from the same folks, the Government Emergency Telephone Service. There is a small monthly fee. I believe it's only a few dollars, and it gives the same priority but on a cell phone. So if your landlines are down, you could still use it on your cell phone if the cell phone towers are still going. And Google Alerts has kind of got a new thing where you can actually sign up to get information on disasters, and you can tell it what areas you want information on. So if you want to know if there's been any earthquakes on the Pacific Rim, you can get information on that. If you want to know if there's something in the next county so you can prepare for it heading your way, you can go on there and get updates. it requires either a smartphone or a pad. So those of us like myself who are still quite happy with our flip phones, it doesn't work on a flip phone, but or it also works on a computer. But if you're out wandering about, it's not going to work unless you have access to the internet. And a few last things, again, is disasters are going to happen. No area is immune to having no disasters. That would be nice. We'd all live there, but it's not going to happen. Disasters are going to occur. It's also important to prepare for media attention, and that's going to happen whether you're prepared, helping prepare facilities or the county for disasters with the special needs population. Someone's going to ask where you were. And the other thing is to ask for help. We have in our county, part of our plan is that if everything goes wrong here, I can contact the Ombudsman in the surrounding counties, and they will help me get buses here to help evacuate our residents and also help find facilities in their area. So other ombudsmen in surrounding counties who aren't affected by the disaster might be able to help. And of course, the last thing here is eventually you're going to need to recover. And recovery, especially if you're looking at Sandy, I was talking to our local Red Cross, and Red Cross is still feeding hundreds of thousands of meals a day to people who cannot cook for themselves still, and it's been months. So disasters are the first couple days. After that, it's recovery or it's continuity, and you may have to work in disaster mode for a very long time after the actual disaster hits. And that takes us to Molly. So I don't know if there's any questions, but or I forget if we were going to do questions in the middle, but I'll turn it over.
Okay, thanks, Karen. So I think we were going to take questions at the end, but if you have questions, please feel free to write them down now. So I'm going to talk to you today about an ombudsman response to unlicensed residential care facilities. In that context, I'll also be talking about what defines an unlicensed facility and a collaborative response that we have here in Los Angeles. So we have a poll here. Have you ever encountered an unlicensed facility? So if you could just take a moment to let me know. Everybody on the call know, be great. Okay, so look, oh, still going. So it looks like about 55% have not, and about 39% have, and 6% aren't sure. So hopefully by the end of this, those who aren't sure will know for sure, and hopefully you'll have some tips on how to identify these facilities in your community. So I'm going to just start by giving the definition of what an unlicensed facility is, and there's a lot of material here, so I'm not going to read every slide, but just give you the broad brush. So an unlicensed facility, and we're talking about California, is one that is providing elements of care and supervision. They're holding themselves out as providing care and supervision, so they're marketing to folks, letting them know that they provide care and supervision, and they may or may not be. The facility accepts or retains residents who need care and supervision, or they represent themselves as being a licensed adult residential facility or a licensed residential care facility for the elderly. And that's from the Health and Safety Code. So it really at the crux of identifying an unlicensed facility versus a congregate living setting for older adults is really whether or not care and supervision is being provided. And care and supervision is any of those activities that are provided, any activities that a facility is providing that requires them to be licensed. So the assistance with activities of daily living and the assumption of different varying degrees of responsibility for the safety and well-being of those clients. So that's not to say that individuals who live in congregate settings can't have assistance with activities of daily living, but the operator cannot be providing those assistance with care and supervision, or cannot be paying other individuals or staff to provide that care and supervision. Those individual residents need to contract for those services independently. So what are activities of daily living? And for the definition of activities of daily living, as it relates to defining care and supervision in an unlicensed setting, we're also including some IADLs, so instrumental activities of daily living as well. So any assistance with dressing, grooming, bathing, other personal hygiene needs, assistance with taking medications, centrally storing and distributing medications, arranging for medical appointments or providing transportation to those appointments, the maintenance of house rules, and supervision of resident schedules and activities, the maintenance and supervision of residents' monies or properties. So if an operator of an unlicensed facility is providing, is the rep payee, for example, for the residents there, that would be considered providing care and supervision. And then also monitoring food intake or providing special diets. So there's some facilities that are exempt and exempt from licensing by community care licensing, and those are health facilities, clinics, homeless shelters, any home or institution or hotel that provides room and board only, and there are no elements of care and supervision being provided. In California, sober living facilities for the recovery of alcohol or drug addiction. If there's no care and supervision being provided, then they are exempt from licensure. Adult alcohol or drug abuse treatment and recovery facilities, those are licensed by the Department of Alcohol and Drug Programs. And there's another exemption. If care and supervision is being provided and the care provider is, oh, there's a fire engine going by me, appropriate for our discussion today. Pardon. So if there's a care and supervision being provided by a close friend or family member and there was an pre-existing relationship between them before they became provider recipient, then that would also be an exempt relationship. Wouldn't be considered providing unlicensed care. And then there are some other specialized facilities that are conducted by well-recognized churches, and the treatment depends on prayer and spiritual means, and those are not considered unlicensed. They're exempt from licensure. So I'm just going to talk a little bit about some of what we're seeing in unlicensed facilities here in Los Angeles. And we started our project about, gosh, I guess it's been about three and a half, close to 4 years ago. And what we are typically seeing is that financial abuse and neglect are the most typical forms of abuse that we're seeing in these settings. We see operators who are often the payee for a resident's Social Security, and then they restrict that resident from access to their own funds. So not only restricting them from accessing, spending money, but also making it very difficult and almost impossible for them to leave the facility because they don't have access to their own funds, and they don't have the ability and the capability to change that relationship. We're also seeing a lot of undue influence by operators, so typically we're seeing residents who are being coached on how to respond to us and to others who come in to try and determine if their care needs are being provided for, and that there are often typically very enmeshed relationships between the residents and the operators. We're also seeing residents who are subject to illegal evictions and homelessness. They don't have the protections of regulations, and even as we know, protections of regulations can sometimes cause illegal evictions, but these folks really, they just don't have access to that. We've had residents who were illegally evicted from unlicensed facilities wandering the streets of Los Angeles and then end up in hospitals in very, very poor condition, dehydrated and very confused, and it's just been a very bad result for that client. Residents are also often, we find them in unsanitary and unsafe living conditions. multiple beds, bunk beds with multiple people living in rooms. So they don't have the benefit um, of the 2-person per room requirement that a licensed facility would require. We're also seeing residents living in garage conversions without heating or air conditioning in parts of our city that, or parts of our county that have extreme weather conditions, or what we consider extreme weather conditions here in California. But it really is a problem for them. We're seeing code violations and safety issues as well, and also some unlicensed facilities being present in commercial properties. So we've found residents who require care and supervision living in a garage, like a mechanic's kind of garage, and very shabbily constructed walls to divide space, and very poor conditions. We're also finding that unlicensed operators may have a licensed facility and that they're using that licensed facility to recruit residents and then moving them to the unlicensed location, and also using the unlicensed location for overflow. So if their licensed facility reaches capacity and they have the ability to take, they think they have the ability to take on more clients by moving them into the unlicensed location. It's a bit of a bait and switch. Staff on site of these facilities are often other residents who are, of course, not trained to handle some of the complex needs of the clients that they're serving, and certainly don't have any training to do so. We're seeing a mix of residents who are younger and older, and some compatibility issues. A lot of the clients we're seeing have mental health conditions and substance abuse histories. We're typically also seeing a lot of in-home supportive services fraud and misappropriation of Social Security funds. Two other just pieces are that typically placement agencies are placing these residents who require care and supervision in these settings. And I'll talk a little bit more about that and the prohibitions for doing that here in California. We're also finding that residents who are living in these facilities were formerly living in licensed facilities but were refused readmission after a hospital stay. So one of the things that we have done to deal with that is we've created a training for hospital discharge planners and social workers about how they can get clients or residents back to the facility type that they had transferred in from, and also how to identify unlicensed care. So I wanted to just give a definition of a placement agency really quickly, so that and some of the requirements that placement agencies have as it relates to unlicensed facilities. So in California, a placement agency is defined by county probation department, mental health, the public guardian, acute care hospital discharge planner, a conservator, a regional center, the Veterans Administration, and a state or privately funded placement agency or referral service. And this becomes important because under our health and safety code, placement agencies have two responsibilities. One, they're not allowed to place a client who requires care and supervision in an unlicensed facility, unless it's an unlicensed facility that is exempt from licensure, as I discussed before. And it is a violation. It's a misdemeanor. It's punishable of up to $1,000 and imprisonment of up to a year. So that's part of what we talk to our social workers and discharge planners at hospitals about, so that they're aware of this. And none of, we've done trainings throughout our county, and not one of them was familiar with this requirement. There's also an additional requirement that placement agencies have, and that's that any employee of a placement agency who knows or reasonably suspects that a facility is operating without a license is required to report this to community care licensing. And again, failure to report is a misdemeanor, and there's a fine and some jail time associated with not doing that. And of course, in our county, we weren't seeing people, we weren't seeing those reports occurring. So I just want to talk a little bit about a collaborative approach that we have here in Los Angeles County in terms of dealing with these types of facilities, and it'll include the Ombudsman role in this. So we have a task force. It's called the Residential Placement Protocols Task Force, and it was formed to ensure that there was a coordinated response by various agencies to facilities. So it deals with unlicensed facilities, and it also deals with licensed residential facilities where we have multiple violations and there's the requirement of a multi-agency response. So what we were finding is that lots of different agencies had a certain responsibility within these settings, but then they weren't communicating with each other. So you might have code enforcement who went out on a code violation and, didn't know, could have notified, community care licensing and some of the social services that there were residents who needed care and supervision and that were at risk. And so, and other other agencies that were involved that really didn't were doing their investigative piece but not communicating. So this group came together to start communicating. We convene every month and discuss strategies for working complex cases and also dealing with chronically non-compliant operators because we have a lot of those. The members of our task force, it's a pretty long list. The LA County Chief Executive's Office heads the task force, the Ombudsman Program, Adult Protective Services, Code Enforcement, the District Attorney's Office, the City Attorney's Office. We have Fire, Health Services, Alcohol and Drug Program Administration, environmental health. We have mental health, patients' rights advocates, probation, public works, building and safety, regional planning, sheriff's department, the Attorney General's Bureau of Medical Fraud and Elder Abuse, Social Security's investigative unit, and in-home supportive services. So typically we have a smaller team that has a coordinated response to unlicensed or suspected unlicensed facilities in our county. And that includes community care licensing, the Ombudsman Program, and the Department of Mental Health's Patients' Rights Advocates. We conduct joint visits regularly at these locations. So if we get a complaint, we're communicating via email and setting up time to coordinate our response. And part of the reason for that is in unlicensed locations, unlike licensed locations, there's safety issues. You don't know, you really don't know what you're walking into. And so prior to having this coordinated response, each organization that had a responsibility to respond was sending 2 staff members out. And so with this response, we're able to send 1 staff member out and more effectively utilize our resources and also try and eliminate interviewing people, 3 and 4 times when you have all these different groups coming in. Part of our coordinated responses is we see fire violations. So we see locks on doors that allow the operator to lock clients away. We had a basement area where residents were there were living quarters down there, and there was a lock on that door from the outside only where residents could be locked in, no windows and no other exits. And we had some great concerns about that. So we'll report, of course, on-scene fire violations. We'll also conduct follow-up visits because there's a requirement to conduct follow-up visits that community care licensing has, and the team felt like we all needed to kind of come back together and check in on whether or not any improvements had been made or violations had been remedied. We also will determine if we need further assistance and a larger group response with code enforcement's nuisance abatement team taking the lead, and any combination of the partners. So at those monthly meetings, it's important for us to have those conversations and kind of figure out if there's a greater need. So if there's even more violations than we had anticipated, or then there may be the need to bring in a larger team. Gaining entry into facilities can sometimes be difficult, so we've used law enforcement to assist us with that in the moment. And also sometimes we've used probation or parole to help us gain entry. So we often are finding that there are probationers or parolees living in these locations, either they're the elders or they're mixed in with the elders or dependent adults at the location. So if they have a client there, then we're able to they're able to help us gain entry because they have a right to go on site. So I have just a little bit of information about what community care licensing's responses to and their complaint process. So when they receive a complaint, they have to write that complaint up, and then within 10 days go on a site visit. Often, we're joining them on these visits, and often we're going sooner than the 10 days, depending on what the need is at that facility and the type of allegation. They will issue a notice of violation of the law if care and supervision is present, and then the facility has 15 days to either submit an application for licensure or cease unlicensed operations. And what that means for them to cease unlicensed operations is really to remove and move out anybody who requires care and supervision, because often there are, some people that do need care and supervision mixed in with people that do not. And after that 15 days, community care licensing and the team will return to see if things have improved. If unlicensed care continues and there's no application submitted, then civil penalties are issued. And so for an unlicensed adult facility, it's $200 a day. For an unlicensed elderly facility, it's $100 a day. And that's from day 1 to day 15, and $200 a day from day 16 until the operation ceases. And licensing can seek an injunction order from the Attorney General's office or seek criminal prosecution through the district or city attorney's office. And we actually have some cases in our county that licensing is doing. So for the Ombudsman program responsibility in unlicensed facilities, so let me say first that in some communities in California, Adult Protective Services really fulfills this role, and in others it's the Ombudsman program. So we have some jurisdictional differences throughout California in terms of who takes on this role, and in looking at the regulations, you could see APS taking it on, and you can see Ombudsman taking it on. There's enough language there that allows for either organization to do so. In Los Angeles County, they've made a decision that they believe that Adult Protective Service believes that it's within the Ombudsman program jurisdiction, and we believe that as well. So in our county, the Ombudsman program takes on this role. So we conduct complaint investigations on behalf of residents in unlicensed facilities that are providing care and supervision. So we're not conducting investigations in an independent living facility where older adults are just living congregately. We're only conducting complaint investigations in unlicensed facilities that are providing care and supervision. What we do is we determine who placed the clients in this inappropriate setting and report those placement agencies to the proper authorities. We report operators to law enforcement or the Bureau of Medi-Cal Fraud and Elder Abuse when appropriate. We provide residents with referrals to licensed facilities, and we make referrals to Adult Protective Services on behalf of residents who require immediate placement. And assuming they meet APS criteria and that we have consent from that individual to make the referral. If we don't get consent from the resident to make the referral, there's generally someone else on our team who is able to do so because they don't have the consent and confidentiality provisions that would hamper our ability to make that referral without the consent of our resident. We also make referrals to Social Security, in-home supportive services, and other members of our task force if we see or if we suspect violations of in those areas. Another really important role that we serve in on this team is to advocate for the best outcomes from our partner agencies, and that includes helping them to take a resident-centered approach. I think that's at the center of all that we do, and certainly in unlicensed facilities, that's one of our purposes. If an unlicensed facility applies to become licensed, then we will make ongoing unannounced visits because that process can take a long time, and we want to ensure that folks are getting their needs met. So I wanted to introduce you to an unlicensed facility fact sheet and screening tool, and there'll be there'll be a little screenshot of it coming up soon, and we'll make that available for folks in Word format so you can update any of your referral information for your county if it's something you're interested in. And it was designed for quick identification of unlicensed care facilities, and also gives referral information to the agencies that handle complaints in those settings. In our county, really the gatekeeper of complaints and where we get the most complaints, and the starting point is either through community care licensing or the Ombudsman program or Adult Protective Services. The unlicensed facility fact sheet and screening tool was designed for individuals who come into contact with elders and dependent adults who may be living in unlicensed care facilities and may be at risk of abuse and neglect. So some of the people that we've provided this to is in-home supportive services workers, adult protective services staff, ombudsmen, firefighters, police officers, building and safety staff, regional planning, regional centers, hospital social workers, Department of Mental Health, and others. And the fact sheet really helps inform people of what the problem is quickly and where it's defined in the law. And then the screening tool really helps people quickly identify and report so that they can make the appropriate intervention. So there's sort of a bit of a fuzzy copy of our unlicensed facility fact sheet, but you can see it just has the definition of an unlicensed facility, defining elements of care and supervision, and also listing facilities that are exempt from licensure, and then who you can call. The screening tool is really simple, and we actually have two fact sheet and screening tools. One's for placement agencies, and it indicates what their responsibility and commitment is based on the earlier slide that I gave you. And this one is the tool that we use for everybody. So we really use language, we're not using language like ADLs. We're using really basic language that sort of cuts across different professions. And so if you check yes on any of those, then there is a suspected unlicensed facility. So for more information, you're welcome to contact me. I have other materials that we have created from this project. So we have the fact sheet and the screening tool. I have a compilation of unlicensed facility regulations, a training for hospital social workers and discharge planners on the transfer and discharge rights of residents in long-term care. I call it the recipe. It's a recipe for how to get your clients back to the facility they came from. And then I also have an article on this and other elder justice projects that was featured in the Journal of Elder Abuse and Neglect for more information about the project.
Thank you so much, Molly. This is great information. I see we have a question from Wara Callis. Is there a way for the public to know if these placement agencies have been reported for improper placement?
I'm not aware of that, and I think also because so many, what we learned really quickly is that the placement agencies didn't even know that this was in the law or a requirement. So no, I don't know of any.
Are there any additional questions from the participants who are able to type in their questions in the chat pod? I see a question from Terry Kez. Will we be able to receive the PowerPoint slides? Indeed, our presenters have made these available. We will be sending them to you by email. And we will also have both the slides and the recording available from the Center on Elder Abuse website, centeronelderabuse.org, on the training, in the training section. There you'll also find recordings of other webinars and other training materials that you are welcome to download and use for your various purposes. Any additional questions in our last few minutes? Well, Karen, I was really interested in hearing about the standard operating plan for disasters, that each county has their own. And are there some key variations that you find are really relevant to how different ombudsman programs would then be able to carry out the development of a plan?
Well, every county's kind of got its own sort of high priority issues, whatever, if they have a lot of railroad activity in their county. So that's probably going to be more of an issue in those. But the ombudsman programs, those who are involved or who are interested, can get a copy of those SOPs and review them to see what the county's plans are for their special needs populations and care facilities. And once you review that, you can look at them, find out, if there's a role for the ombudsman. If they've got it covered, great, but it's not been my experience that that's the case. So, they can look at them, figure out, where the county is at in its planning, and then, of course, try to figure out what role they might want to play in the disaster part of it. And if anyone's got any questions about how to review those or what possible roles they might want to start, I'm also happy to take calls or emails. People can get a hold of me.
Fantastic. Thank you very much. For those who are still on the line, just to remind you, you will receive a link to a short online survey so that you can share your comments for our presenters, as well as feedback on the webinar. It's very short, and we'd also love to hear from you on your ideas for future webinars. You can see Alicia, under the guise of Mary ST, is pointing to the link for the webinar survey. And if you'd like to learn more about our presenters today, you can go to their organization's websites. We have the web links available. Also want to invite you to visit us at the Center on Elder Abuse for additional resources, training materials, research findings, tools like a free mobile app on elder abuse and neglect, handouts, and information on free materials and a grassroots movement for raising awareness of elder abuse and neglect through the Ageless Alliance. I'm sorry, I'm having a little trouble advancing to that slide, but please do feel welcome to contact us. You can send a reply to, or you can contact us online by going to centeronelderabuse.org and clicking on the Contact Us feature, or you can find ways to contact us by opening the emails that you've received in relationship to this webinar. Again, thank you so much to our presenters, Karen Jones and Molly Davies, for our participants, for all the work you do with older adults and vulnerable adults. Thank you to Alicia Chan for engineering our webinar, and to the Archstone Foundation for making this all possible.